give me this opportunity. So what do you think after seeing this picture? Hair makes our first impression. Hair can have huge impact on our appearance, on the social acceptance and self-confidence. Hair basically frames the shape of our face. And these days, males and females are very conscious about their looks. This is the era of selfie. I'm going to share some statistics about the hair loss. These statistics show that in 2017 in USA, 1 in 4 women suffer from hair loss. Hair loss as well as thinning of hair. And 25 million women presented to the healthcare clinics with the complaint of hair loss, just in 2017 in USA. Similarly, 4 in 7 men presented with hair loss, and out of these, 95% of them were suffering from androgenetic alopecia. 60% of the men will have to deal with the hair loss by the age of 50, and 50% of women will experience hair loss in their whole lifetime. Some other facts from the surgical hair restoration procedure clinic in America, that after a survey, 60% of the men said that they will prefer to have more hair than to have more money. So that shows the impact of hair for most of the people. For those, this is an important for them. There are many procedures for hair loss. There are many treatment options, starting from finasteride to minoxidil to different topical growth activator serums, oral vitamins, oral minoxidil, PRPs, SPF, stem cell therapies, and even hair transplantation. But still, there is unpredicted outcome. And patients, especially young males, are ready to spend their every penny to get their hair back. Researchers are working to introduce new therapies, and a big breakthrough in the field of hair and skin regeneration is basically exosomes therapy. I'm going to discuss about the role of exosomes in hair and skin. We'll briefly give you the background, introduction, potential sources of the exosomes, role in hair and skin, their administration protocol, as well as the FDA statement, facts, and then I will conclude. Now, mesenchymal stem cells, they were introduced in early 2000. Since then, they are in different clinical trials because of their multipotency and ease of accessibility. They have been isolated from various adult tissues like placenta, cord blood, adipose tissue, genital bulb, and testicles of brain, etc. It was shown in different studies that these mesenchymal stem cells are not directly involved in the therapeutic processes. When they are injected, in some of the cases, because of the low cell viability and low number of cells tend to fuse with the recipient cells in the host tissues. It was seen that they produce their therapeutic effect because of the release of biologically active molecules, which are basically extracellular cells. There are different types of extracellular cells, the nanovesicles, microvesicles, and apoptotic bodies. Out of these, exosomes or the nanovesicles are the one which contains the biologically active molecules, which were basically involved in reacting the different regenerative processes. So basically, what are exosomes? Exosomes are the nano-sized extracellular vesicles. They are lipid bilayer structures. They carry diverse molecular, they carry diverse molecules like lipids, proteins, DNA, genetic material, growth factors, different enzymes, and they are the one which basically attaches to the receptor cells and then activate the regenerative process. They are secreted by every cell of the body, and they are involved in the cell-to-cell communication. Exosomes can act as a cargo for drug delivery, and this will be the future. Every cell of the body releases extracellular vesicles in the extracellular environment. There are different sizes of these extracellular vesicles, and exosomes are the one which is 30 to 150 to 200 nanometer in size. They are used in intercell communication in paracrine signaling, in cell-to-cell communication both at the local as well as at the distant communication. These are different types of extracellular vesicles. Exosomes are basically formed by the fusion of the intraluminal vesicle with the multivesicular body, and then they are released out of the cells. Whereas microvesicles and apoptotic bodies are formed by the outward budding from the cell membrane. This is the structure of the exosome. So stem cells basically produce secretome and the exosomes, which contains growth factors, anti-inflammatory cytokines and genetic material, which then attach to the receptor cell to produce either the skin or tissue regeneration or immune modulatory effects. There are different sources of the exosomes. They can be acquired from dendritic cells and from CD34 stem cells from the blood, amniotic membrane, cord tissue, bone marrow, dental pulp. The exosomes available in the market, they are being produced by 26 different companies. They could be natural or engineered. Among natural, they could be humanized, plant or animal origin. Among the human ones, bone marrow mesenchymal stem cell derived exosomes are available. Dermal papilla cell derived exosomes are available, which are very effective for hair regrowth. Hair follicle stem cells, adipose tissue derived stem cell exosomes, outer root sheath derived exosomes, macrophage derived, fibroblast derived, and even the colostrum derived exosomes are also available. Among the plant origin, rose stem cell extract exosomes are available in the market, and they are also present in Pakistan. And in animal origin, they arise from mouse and rabbit. The lab generated or engineered exosomes are basically the one. Initially, in different studies, basically the naturally released extracellular vesicles were used, but because of the low yield, there were limitations in the studies. So to overcome this limitation, researchers produced a new method of production of these exosomes in the laboratory, and approximately 20 to 100-fold more number of these nanovesicles can be produced in 1/20th of the time required for the natural extracellular vesicles production. This diagram shows the different cell-derived nanovesicles which are involved in the hair regrowth. They could be derived from the mesenchymal stem cells, dermal papilla cells derived, and from neuroprogenitor cells. I will not go into the details of the exosomes biogenesis. We must have covered it. These are the important processes. The extraction of the exosomes from the adipose tissue, from the adipose stem cells, or from the bone marrow stem cells, or from the placenta-derived origin. Then they are cultured in the conditioned media, and then there is isolation and purification of these exosomes to avoid any unwanted molecules, and then they are marketed as an exosomes. Out of all these three, the most important step is isolation and purification, which basically identifies the quality of the exosome. The more purer or it is isolated, more better, then it is more efficacious and more safe for the patients. There are 26 patent companies all over the world, from USA, Europe, Australia, Korea, Japan and China, which are basically marketing the exosomes. The basic mechanism of action of exosome is angiogenesis and role in inflammation regulation. They are strong anti-inflammatory agents which have been proved in different studies. They cause tissue regeneration by collagen synthesis and immune modulation. They normalizes the damaged hair environment by their anti-inflammatory effects, by regeneration and wound healing effects. They have a high absorption rate because they are the nanoparticles. They have anti-aging and they promote hair follicle cell growth. Different effects of these hair-related exosomes are basically because of the release of certain growth factors, and there is an important role of signaling of beta-catenin pathway which is involved in hair follicle stimulation. There are certain other proteins and some enzymes are required for the other effects like anti-inflammatory effects and wound healing. जब मैं इस लेक्चर को प्रिपेयर कर रही थी, I come across a lot of lectures. There were more than 300 articles related to exosome therapy available just on the PubMed. बाकी सब मतलब इन सबको मिलाएं तो there will be a huge number, and out of these many were on the hair and skin. This is one of the paper which was published in July 2020, and it shows that basically the dermal papilla cell derived exosomes they are really effective in improving the hair growth. They basically induce the progression of hair follicle cycle from telogen to anagen, and because of this step, because of the progression of hair follicle cycle from telogen to anagen, there is decrease in the hair loss, there is accelerated hair growth rate, and there is improvement in the hair overall. This shows that the dermal papilla cells, exosomes basically, they were effective in proliferating the human dermal papilla cells by up to 30%. This picture is taken by the last article I have shared with you. There are other articles also which shows that they promote the hair follicle conversion, and the adipose derived stem cells are very effective in hair regrowth. So they accelerate the hair growth, they promote hair follicle regeneration, and they promote hair cycle change. Other articles are also present. This is an article, this was a literature review, and it was carried out by entering the word exosome, alopecia and hair loss, and the 47 articles were involved in this, which basically concluded that they are very effective in hair regrowth, but because of the limitations in potential sources of the exosomes, and there is no standardization of the isolation and purification procedure, so the safety data is still lacking. This is the latest article, Exosomes and Hair Restoration, published in February 2023, claiming the same. Exosomes also have a role in anti-aging of the hair. It has been proved that exosomes were effective in increasing the melanin synthesis. Because of this, it is basically postulated that exosomes increase this tyrosinase activity, and because of increased tyrosinase activity, there is increased melanin synthesis. This is the concept which is being utilized in patients of vitiligo for repigmentation of the white patches, as well as for the basically promoting the blackening of hair and prevention of white hair. Exosomes have also been involved in the differentiation, in the regulation and migration of melanocytes to different areas. That is why if target exosomes can be used, then they can even cause decrease in the pigmentation of the skin. Now, in skin rejuvenation, FDA approved phase 1 clinical trials for atopic dermatitis, and there are studies going on for aging as well as wound healing. As the life progresses, there are physical changes in the skin cells, there is progressive loss of functionality and regenerative potential, and there is gradual alteration in the intercellular environment. The regenerative abilities of the exosomes are basically again because of three factors: angiogenesis, anti-inflammatory effect, and because of the collagen synthesis. These three are the basic effects of exosomes on the skin. Anti-inflammatory is the most important effect among all, and exosome-derived human adipose tissue-derived mesenchymal stem cells elevate atopic dermatitis. This study was performed on the face and dorsa of the hands of the patient, and there was significant improvement in erythema as well as itching of the patient in the absence of any corticosteroids. And FDA has approved phase 1 clinical trials for atopic dermatitis. Studies have shown that exosomes increase the collagen by 7 folds, elastin by 3 folds, and cell proliferation by up to even 80% have been recorded. Effect of exosomes on various skin defects have been studied. Various skin diseases have been under trial with exosomes like psoriasis, systemic sclerosis, SLE, and vitiligo, as well as certain skin defects which I will share later. Single ingredient exosome can contribute to multiple therapeutic effects because the messenger RNAs and the microRNAs present in the exosomes basically can regulate various cellular responses. This double-blind randomized control trial was carried out, and there was carbon dioxide fractional laser was basically performed on the acne scars of a patient, and on one side exosomes were applied. Only after 3 sessions there was significant improvement in the acne scars on the side where exosomes were applied. There is an important role of exosome in scar prevention by basically increasing the synthesis of collagen type 1 and collagen type 3, and by regulating the matrix metalloproteinases expression, and by regulating the fibroblast differentiation. Similarly, immunomodulatory role of these mesenchymal stem cell derived exosomes have been postulated, and they have been used in cutaneous graft versus host disease, in organ transplant recipients also, and this immunomodulatory role have been basically seen in wound healing also. Another study showing the immunomodulatory therapeutics and skin regeneration. Effects of keratinocyte-derived and fibroblast-derived exosomes on human epidermal melanocytes have been studied. As I've already mentioned, they are doing basically the dual purpose. They are increasing the tyrosinase activity, which has been proven at a molecular level, and because of increased melanin synthesis, they have been used for the repigmentation of the skin as well as repigmentation of the graying hair. So they can be a wonder drug for early graying the canishes. And similarly, they can also be used for decrease in the pigmentation of the skin because of their role in regulating the differentiation and migration of these melanocytes at different levels. Skin rejuvenation role is basically by increasing the pro-collagen synthesis of and basically because of the decreased expression of the matrix metalloproteinases. This is the latest article which was published in March 2023. They are available in freeze-dried lyophilized powder form, and they have to be refrigerated at 2 to 4 degrees centigrade, and after dissolution they should be used within 3 hours. Initially जब Botox launch हुआ था तब उसके बारे में भी हम यही सुनते थे कि इसको within 3 to 4 hours हमें use कर लेना चाहिए. Maybe in future इसकी भी जो safety time zone है after dissolution, it may go to even 2 weeks or 4 weeks as Botox. After dilution, they can be diluted with normal saline, with PRP solution, or with the activating solution which are provided in the kit by different companies. After dissolution, the mixture should be left for 5 minutes for complete dissolution, and they are usually applied same as after cleaning and numbing the area. They can be applied by different ways. Majority of the studies they have shown that exosomes have been applied through microneedling treatment system or by injecting intradermally, that is the mesotherapy. But there are different studies जिसमें CO2 fractional laser और RF microneedling के साथ भी इसको combine किया हुआ है for the face, and low level जो laser therapy है for the scalp as well as microneedling for the scalp has been combined with exosomes. अच्छा, जो इसके number of sessions हैं, they are variable. जो companies हैं, they claim that 5 to 6 sessions every 2 weeks should be carried out initially, and then depending upon the underlying etiology and the underlying indication for the exosome therapy, they can be then tapered off with monthly or even 6 monthly sessions. There are certain pictures of clinical cases I've taken from the articles which I have shared already. Role in male pattern hair loss, female pattern hair loss after 5 sessions at 2 weeks interval. Exosome therapy was done with microneedling. Role in acne scarring, aged skin, just 2 sessions. Pigmentation, here the microsomes were applied with microneedling system, and in this one the mesotherapy, the intradermal injection of exosomes were done. 3 sessions of the treatment were carried out. This is a remarkable improvement in skin necrosis. Exosomes have a role in regeneration and in scar reduction if given in the early phase of the wound healing. Although they have combined multiple treatments, like they have done exosomes with mesotherapy, and it has been combined with 2 sessions of pico laser also. Improvement in wrinkling. My experience in exosomes is limited so far. I have not done exosomes for skin, as for me there are so many time-tested different treatment options are available for skin regeneration. For hair loss, I've done so far on 5 cases and all of them were of endogenetic alopecia. ये सारे patients minoxidil और PRP already for years ले रहे थे along with topical hair activating solutions और oral vitamins etc. एक patient की मैंने अभी तक सिर्फ 2 sessions किए हैं. When he came for a second session after 3 months, I have planned sessions with a gap of 3 months. अच्छा उसके अंदर भी अच्छा उसमें सेशंस कैन बी प्लान्ड एट डिफरेंट इंटरवल्स क्योंकि अभी तक कोई स्टैंडर्डाइज्ड प्रोसीजर प्रोटोकॉल हमारे पास नहीं है इसके लिए. अच्छा जब ये वाला पेशेंट जो मेरे पास सेकंड सेशन के लिए आए हैं ही वाज मच सेटिस्फाइड और फॉर द फर्स्ट टाइम इन 2 years पेशेंट को हेयर फॉल कम्प्लीटली रुक गया था. दिस वाज हिज वर्ड्स क्योंकि जब 2 month का भी अगर पीआरपी के सेशंस के अंदर कोई डिले आ रहा था तो ही वाज सेइंग कि कंटिन्यूस हेयर फॉल है. FDA की सेफ्टी गाइडलाइंस है इसके लिए पब्लिक सेफ्टी नोटिफिकेशंस आ चुकी हुई हैं बिकॉज टिल डेट FDA has not approved exosomes for hair or skin or no exosome therapy have been basically FDA approved so far. 2017 में warning letters were issued to certain companies and in 2019 reports of serious adverse effects were reported by patients in Nebraska. And FDA has given a caution statement for the patients in 2021 which I will share in the next slide. In Nebraska, FDA reports basically blindness, blood infections, growth of the tumors, neurological events and unintended inflammatory or immune reactions and cross-contamination. The only stem cell treatment approved by the FDA so far is for cancers and for the disorders of blood and immune system. This is the FDA warning statement about the unapproved exosome therapies. Patients should be aware of this is available on the FDA website. Patients should be aware of the potential risks related to unproven stem cell therapies because they can cause injection site reactions, failure of the cells to work as expected, there can be growth of tumors, there could be infections and the ability of the cell to move from placement site and multiply or change into the appropriate cell type is basically the most grave concern. These are the certain facts which I would like to highlight that FDA has defined exosomes as a drug. And for a drug, even for a clinical trial, it needs FDA IND guidelines. The investigational new drug application is mandatory for even the clinical trials of any drug. Generally, the exosomes are derived from the human or animal tissue, so there is a risk of infection because of the contamination. Not all culture media are same, not all exosomes are same. And these exosomes may change the behavior inside the body in negative ways and encourage the growth of the precursor cells. There is no doubt that exosomes are on the horizon. They are an exciting therapy and they are the future. But much work has been done and much work is still required to standardize the different procedures. They have been beneficial alternate for the mesenchymal stem cells in the field of regenerative medicine. They are the biomarkers for cancers and other diseases. They are potential candidates for therapeutic drug delivery, regenerative medicine and vaccine adjuvants. I'm sure Dr. Faridun ने discuss कर लिया होगा. There is a huge role of exosomes in neurodegenerative disorders and immunological disorders, in cardiovascular conditions. Target exosomes for hair and skin are still not available. Only a few companies, as far as Pakistan is concerned, only 2 companies are available which are producing target exosomes. But even then, because they are not FDA approved, we are not sure of the safety data. There is storage limitations. आपको मैं एक picture अभी दोबारा दिखाती हूँ. The exosome which has been marketed by USA by the ExoBioco company of the America. This exosome is a pure exosome which is derived from the human placental origin and that has to be transported in liquid nitrogen. So this is the major concern. The storage limitation and low yield and no standardization of the isolation and purification technique is the basic concern. There is no clear-cut information about the exosome source. कि कौन सा exosome source is effective for which condition of the skin and hair. Exact dosage नहीं पता. Optimal delivery mechanism are not yet clear. किसी ने exosomes को intradermally inject कर दिया है, कोई microneedling के साथ कर रहा है. So there is no standardization as yet. अब उसमें जब भी कोई नई चीज़ आती है तो it takes time to develop certain rules and regulations. कोई भी drug हम use कर रहे हैं, still हम बहुत सारी ऐसी drugs हम use कर रहे होते हैं which are not FDA approved. That does not mean कि हम वो यूज़ नहीं कर सकते. बहुत सारे biologics हैं जो भी हम यूज़ कर रहे हैं, but there has to be some randomized controlled trials without conflict of interest. At present, most of the RCT trials available हैं, they are by the patent companies who are already sponsoring and who are already marketing exosomes. अच्छा, एक चीज़ मैंने आपको बतानी थी जो पीछे मिस हुई है, मैं सर आपको ये अच्छा ये है वो जो मैं बता रही हूँ. दिस इज द प्योर एक्सोसोम. The purchasing cost of this exosome is around 1.5 lakhs. It has been derived from human placenta, and this exosome even can be given by IV route. Pakistan में भी यूज़ नहीं हो रहा, लेकिन there are patients which I know जो इसको IV from America इसको यूज़ कर चुके हुए हैं. ठीक है. This contains 5 billion exosomes for hair and 2.5 million for the skin. ये कंपनी है जो हमारे पास यहाँ पे सेपरेट किट फॉर हेयर एज वेल एज फॉर स्किन लॉन्च करी. दिस इज बेसिकली ह्यूमन एडिपोज टिश्यू डिराइव्ड स्टेम सेल. Then again, Pepdeva is they have separate kit for hair as well as for skin, and this is also derived from the adipose stem cell. In this, they have combined rose stem cell extract also. यानी कि human adipose tissue derived stem cells हैं, and they have combined it with plant origin rose stem cell extract. Another one which is derived from the human cord blood cell exosomes. So these are the ones which are available in Pakistan at the moment, which I know of. Thank you very much.